Welcome to the Center for Opioid Research, Education, and Outreach webinar series. This program is made possible by a grant from the Alabama Department of Public Health in cooperation with the Centers for Disease Control and Prevention.
Hello, I'm Dr. Taylor Stuber, and I'm an assistant clinical professor in the Department of Pharmacy Practice at Auburn University Harrison School of Pharmacy. Thank you for your interest in this presentation about home drug testing. This presentation was made possible by the Alabama Department of Public Health, as well as the Center for Opioid Research, Education, and Outreach. I have no relevant financial disclosures or conflicts of interest with the presented material in this presentation. After completing this presentation, participants should be able to discuss the role of home drug tests for families of and those suffering from drug use disorders, review drugs commonly included in home drug tests, describe appropriate use of home drug tests and the importance of timing, discuss common causes of false negative or false positive drug tests, and provide information related to access to home drug tests. Home drug tests offer many advantages and disadvantages that are worth considering. They are a quick, inexpensive screening tool that allows to identify the presence of a substance of abuse, and by doing so, they would offer the potential to identify substance abuse, leading to early intervention and treatment. There's also the potential to reduce substance abuse, and that thought is not necessarily backed by scientific evidence. There's also many disadvantages that we would have to consider. With the use of home drug tests, there is a potential to create distrust, resentment, and suspicion, and potentially harm relationships. There's also a potential to lead to punitive measures alone rather than a comprehensive assessment and treatment plan. For these reasons, American Academy of Pediatrics recommends against routinely using these types of tests due to their complexity, the potential to create distrust and harm relationships, and the lack of evidence to support that they would actually reduce substance abuse. That is not to say that there is no role for home drug tests, and it just highlights the importance of understanding how they are interpreted and implemented. There are three main types of home drug tests that can be purchased and conducted at home. The most common is the urine drug test, which can be conducted at home and results can be available at home within 5 to 10 minutes. This is by far the most common and is the one that I'll primarily be referring to for the remainder of the presentation. Hair tests are also conducted at home and results can be available as well at home, and they might have the potential to identify substances that were abused further back than urine drug tests. Saliva are less common types of tests and usually require the test be sent to a lab to confirm the results. With many of these tests, including the urine and hair tests, they are conducted by a process known as immunoassay, which is just a screening type of test that is very prone to false positives and false negatives, as well as misinterpretation. So with many of these kits, they come with an already labeled test that is postmarked that can be sent to a lab for confirmatory positive results. By doing a simple Google search, you'll see that there are many tests available that include many different combinations of substances. The illicit drugs and prescription drugs listed here are the most common drugs that are tested for on home drug tests. They can be tested in either combination or a comprehensive drug test that would include all of these or their individual components. With each of these, it just highlights the importance of reading the label and knowing what exactly it is that you're testing for, so that you know that you're conducting the most appropriate test at that point. The table here highlights the importance of timing with home drug tests. On the far left, you see the drug or drug category or drug class of the substance of abuse. In the middle column, you see how long after or how soon after taking a drug that a test result will be positive. And then on the far right column, you see how long a test result will continue to be positive after taking that drug. Most substances of abuse will turn up positive within hours and certainly within the first day after ingesting the substance. For most drugs of abuse, they will continue to be positive for about 1 to 4 days and remain in the system. However, there are a few exceptions. With THC, that can continue to be positive for 1 to 7 days and even up to 1 month if used chronically. PCP and barbiturates can remain positive for up to 1 to 3 weeks. So it's important to kind of note these differences. And another thing to note is that this can vary greatly by individual. A lot depends on how long they've been taking the substance, the amount that they've ingested, and just the individual's differences in metabolism compared to the rest of the population. However, this can provide a valid estimate of that. When interpreting home drug tests, it's really important to note the limitations and the potential for false positives and false negatives. First, false negative, which is when the test fails to detect a drug or metabolite when one is actually present, can be caused for a number of reasons. First, the sample could be too diluted to detect the presence of the substance. Maybe the person that's taking the test has drank too much water before. The test itself could be expired, or the components of the test could be expired, so it's important to check the expiration date. The wrong test could be purchased and the wrong drugs could be tested for, which is why it's important to read the label and know what you're being tested for. Finally, as I mentioned on the previous slide, the timing of the test is very important, and a false negative could result as a result of being tested too soon or too late. A false positive, on the other hand, occurs when a test incorrectly detects the presence of a drug or metabolite when there actually is not one present. This occurs when a substance cross-reacts with the test. This could be from another prescription drug, an over-the-counter drug, or even food substances that have a similar chemical structure. Certain substances have a higher risk of false positives, and those include amphetamines and opiates. And then there are some that have been shown to have a lower risk, such as marijuana and cocaine. Now, this doesn't mean that these tests would not require confirmatory results, so that should still be done and sent to the lab if an initial test is positive. And here are some examples of various agents that can lead to false positives for certain classes of substances of abuse. This is not a comprehensive list by any means, but just highlights the very complex nature and multiple things that can cause false positive results. A few things that I wanted to point out are that over-the-counter substances can lead to false positive results. This can be seen with opiates, with dextromethorphan, which is an over-the-counter cough suppressant, and with some food substances such as poppy seeds or poppy oil if ingested in large enough quantities. With amphetamines, there's many common prescription drugs that can lead to false positive results, but there's also some over-the-counter medications that can lead to false positive results, such as pseudoephedrine or Sudafed. So again, this just highlights the very complex nature and multiple things that can cause false positive results when interpreting these tests. This slide includes a suggested workflow for conducting home drug tests and certain considerations to have. When you're considering conducting a home drug test, it is important to follow these steps and be mindful about the process. When one is considering conducting a home drug test, whether it be due to a substance abuse suspected, maybe that's because of an attitude or behavior change, maybe there is some thought that it would lead to a prevention of substance abuse down the road, Either way, it is important to consider the risks and benefits or the disadvantages and advantages of what a home drug test entails. Before conducting the actual test itself, it's important to consult with a healthcare provider. These tests are very complex, are easily misinterpreted, and it's important to consult with them in order to develop a comprehensive assessment and plan, and they can also provide resources to help with interpreting the tests, having conversations with adolescents or family members, and implementing the results of the test. So after you've consulted with the healthcare provider and after you've conducted the test itself, if you were to receive a negative drug test initially, this could be due to a number of reasons. Hopefully there's some reassurance there that substance abuse is not actually occurring. Maybe you have to consider some of the false negative testing possibilities, and those are important considerations. But go ahead and have follow-up conversations with your adolescent or family member and continue to monitor for suspected behavior and continue to look for signs of substance abuse, and you can consider retesting in the future. With all of these steps, make sure again to consult with your healthcare provider. If the initial test is positive, it is really important not to panic and not to implement punitive measures at that point. Before you take any action, the first step is to send for a confirmatory test. Remember, there's a lot of possibilities for false positive tests, and these can result from multiple different substances. So once you have sent that off and have confirmed the results, then at that point, you can implement the treatment plan. This treatment plan should have already been decided upon with you and the help of a healthcare provider. And so whether that be an abstinence test, whether it be further urine drug testing in the future, or potentially even counseling or rehabilitation services, that plan should already be decided upon. Continue to have those conversations with your adolescent or family member, and again, follow up and discuss with a healthcare professional. In summary, home drug tests are a very complex process. They can be very easily misinterpreted, and all of the risks and potential benefits should be evaluated before using them. Consideration should be taken on what effect it'll have on relationships, whether it might build distrust, with the potential benefits of potentially identifying substance abuse or detecting substance abuse early to lead to early treatment. With all of these, it's important to consider false positives and false negatives, as well as consult with a healthcare provider so that you can get the best possible outcome for your adolescent, your family member, or your patient. Here are additional resources that you can consult if you have any further questions. Thank you for listening to this presentation today about home drug tests, and thank you to the Alabama Department of Public Health and to the Center for Opioid Research, Education, and Outreach for their support of this program.